Hello and good evening, ladies and gentlemen, and welcome to the Go Beyond Keynote Speaker Series, a series that's exclusively brought to you by RCSI and UCD Malaysia campus as we celebrate our Silver Jubilee anniversary this year. Thank you very much for joining us this evening. I'm Kasturi, the PR and Communication Specialist at RUMC, and I will be your moderator for today. Before we begin, let me take you through a few items so you would know how to navigate around the platform. You should be able to see your attendee interface on the computer desktop on the right-hand corner. By default, you're listening to this session using your computer speaker system, and you will be put on listen-only mode. You'll have the opportunity to submit text questions to our speaker today by typing them out on the questions tab in the control panel. And please feel free to send in your questions at any time during the event. So let's dive into everything that you should know about your eyes. Our eyes are one of the most fascinating and complex parts of the body. But how much do we really know about our eyes and its function? Have you ever wondered when you should get your eyes checked? And what is cataract and its common symptoms? Now, this session will give you the answers to all these common questions. So next, allow me to introduce our distinguished speaker for today, Dr. Fiona Chew Lee Min. Dr. Fiona is an alumnus of RUMC from the class of 2002. It was during her posting at Hospital Tengku Ampuan Rahimah Klang, Dr. Fiona was first introduced to ophthalmology. She fell in love with ophthalmology as it was one of the few medical specialties which allowed her to practice medicine and surgery at the same time. Dr. Fiona obtained her master's in ophthalmology from the University of Malaya. She then pursued a clinical fellowship in pediatric ophthalmology and strabismus from the Singapore National Eye Centre and also received the certificate of completion of fellowship training for pediatric ophthalmology from the Malaysian Ministry of Health. And after fellowship completion, she served in Hospital Kuala Lumpur as a consultant pediatric ophthalmologist and later transferred to Hospital Selayang, where she was the head of pediatric ophthalmology unit and head of the research unit in the ophthalmology department of Selayang. She began her service at the Sunway Velocity Medical Center KL in 2019 and contributes free service to Hospital Selayang as a visiting consultant pediatric ophthalmologist. And one of Dr. Fiona's most notable achievements include the Award of Pediatric Ophthalmology Service Provider of the Year in Asia Pacific for the year 2020. I will now pass the session to Dr. Fiona to begin her sharing on eye health and some common diseases revolving around it. Over to you, Dr. Fiona.
Thank you very much. Just let me get ready my webcam.
Okay.
Hi, everyone. Can you see me?
Give me a second.
Not yet, is it? Okay, cool.
Yes, now can. Okay, Dr. Fiona, over to you.
Okay, sure. I want to thank everyone for inviting me for this session. It's an honor to be speaking for my alumni. So basically, today's talk is pretty simple. No difficult terms. It's basically what you should know about your eyes. So let's start talking about everything you should know about the eyes. So basically, the eye is a very important organ because it contains more than 1 million nerve cells. And basically, it can do a lot of fascinating things, such as it can distinguish about 10 million colors. And from far, far away, you can see things like the candle flame. And most importantly, for our eyes, we do 80% of learning through our eyes. So the question is, a lot of people go for health checkups. I know we go for yearly health checkups, but do you go for your eye checkups, or do you know when to go for your eye checkups? Usually a lot of people tell me, oh, I've gone for my eye checkup, and actually they've never actually gone for an eye checkup. What they have gone is gone to the spectacle shop where they are asked to read ABC. Now, this is not an eye checkup. So this is a schedule, a recommended schedule on when you should go for your eye checkup. Children from birth can be screened for eye disorders. Usually the screening will be done by the pediatrician. Then after that, about every 2 years, they're recommended to go for an eye checkup to rule out any eye problems. For adults, it's pretty simple. Less than 60 years old, you must go for you must at least go for one eye checkup. And if it's normal, you can go for it every 1 or 2 years. If you're after 60 years old, you should go for an annual eye checkup. Now, what is a full eye checkup? As I have mentioned, a full eye checkup is not going to the spectacle shop and asking them and then for you reading ABC. A full eye checkup comprises of 4 components. Number 1 is taking of vision. Number 2 is checking your refractive status. Number 3 is a dilated eye examination. And number 4 are special tests if required. Vision is pretty simple. Basically, you'll be shown a chart of letters or numbers, or for children, pictures, and you'll be asked to identify the symbols to see if you can read to a certain level. This only determines how sharp you can read centrally. It doesn't check you for cataract, it doesn't check you for glaucoma or anything else. Next, usually we'll determine your refractive status, meaning we'll need to see if you are short-sighted, if you're long-sighted, or if you're things like astigmatism. Then the doctor will proceed with a dilated eye examination. This means they will actually put drops into your eyes to dilate the pupils. This is so that once the pupil is dilated, the doctor will have a clear view of the lens and can see the nerve behind the eye to give you a full eye checkup. Then later on, the doctor may proceed with special tests to check to ascertain your risk of glaucoma and to see how well you can see. Now, what are the common eye problems in clinic? Well, the first one, patients usually present with blurring of vision. Second, they may present with something called floaters. And third, they may come with just tired eyes or eyes being unable to focus. Now, we'll be going through these one by one. Now, the common causes of blurring of vision are usually refractive error, cataract, and glaucoma. Refractive error is basically like a very, very complex term, but usually we just want to determine if you have short-sightedness, long-sightedness, or astigmatism. In short-sightedness or myopia, you cannot see far. With hypermetropia or long-sightedness, you cannot see near. For astigmatism, you can see far, you can see near. However, the images are distorted, so everything appears either glaring or fuzzy. So with these kind of conditions, it's easily treated. Either you can wear spectacles, you can choose to go for contact lenses, or even refractive surgery. Now let's talk about cataract. All of us actually have a lens inside our eye. From birth, already everyone is born with an internal lens. This is not a spectacle lens. Basically, this lens function is to focus the light so that we can see clearly. Usually at birth, this lens is clear, but usually after about 50 years or 55 years old, this lens starts to get cloudy, and this clouding of the naturally clear lens is known as a cataract. As you can see in the first picture, there's actually a clear lens. This is the pupil. It should be nice and black, meaning the light is going through well. In the second picture, you can see a white opacity covering the pupil, and that is known as the cataract. So what are the signs of a cataract? If just say you've never gone to a doctor, number one, obviously, if there's something blocking your vision, vision will be blur. Also, this cataract doesn't just blur your vision. What happens is it causes light to be distorted when it goes into your eye. So you have quite a lot of glaring. When you see lights at night, the lights are broken up, or sometimes you see double. And another sign which may tell you have cataract is that you keep on changing glasses. Usually for adults, you shouldn't need to change glasses unless there is a problem with your eyes. Usually your power should remain stable for at least 4 to 5 years. Or other signs of cataract is if you have double vision, or at night when you drive, you have poor night vision. Another sign of cataract is if you start to think that the lights are dim in the room. There are quite a lot of my patients who come and say that the first sign they have of cataract is actually when they think that the lights are dim or the lights are not working, and they keep on asking their relatives to change the light bulb. This is actually because the cataract has reduced the light going into the eye, so they can't see, so they assume, oh, the light is not working, but they didn't realize the problem is not with the light in the room, but the problem is actually with their own eyes, that they have reduced vision due to cataract. So these are the signs of cataract. So what are the treatments for cataract? Basically, if it is mild, not all cataracts need to be treated. If they are mild, they don't obstruct vision, we can just observe them, maybe ask them come back 6 monthly or up to a year. However, if the cataract is serious, then we'll be talking of surgery. Of note, I know sometimes if you see in Facebook or you see, on the internet, sometimes some people may claim, oh, we have magic eye drops which dissolve cataract. At this point in time, the gold standard for treatment of cataract is still surgery only. There are experiments ongoing on animals. However, they've managed to dissolve the cataract, but they haven't managed to replace the lens. So obviously the eye drops do not work yet. So please don't go and buy unverified eye drops, because these may harm actually rather than help your eyes. Now, cataract surgery is pretty straightforward. It's one of the safest surgeries if you could go for, because it has about a 95% success rate. Usually it's a daycare surgery. That means you don't even stay overnight in hospital. You come in for the surgery, and then within a few hours, you're out of the hospital. Usually the surgery itself is pretty fast. If the cataract is an uncomplicated cataract, it should be anywhere ranging from 10 minutes all the way to maybe half an hour, but usually less than half an hour. What we do in the cataract surgery is we make small incisions, less than 3 millimeters, and we use the phaco machine to go in and suck out the cataract and replace it with a new artificial lens. Usually vision should recover within a day depending on the anesthetic being used. As you can see in the photos here, the first photo on top shows the phacoemulsification machine going into the eye to cut the cataract. Later on, we suck out the debris, and at last you can see a new intraocular lens is implanted to give the patient clear vision. Now, there are a few myths of cataract surgery, and the number one myth of cataract surgery is cataract only affects old people. This is actually false, because for cataracts can happen at any age, even from birth. There are some babies born with cataract. Yes, babies can also get cataract. Why? Maybe because of, they had an infection while they were in the mummy's uterus, or maybe due to a certain medications which were taken, or due to hereditary causes. Young people can also get cataract if, just say, they have any eye inflammation or trauma to the eye, or if they're taking steroids. Now, I'll come back to steroids a bit later on. All right. And also, you may get cataract earlier if you have diabetes, hypertension, or if you smoke. So obviously, cataract does not only affect old people. The next myth of cataract surgery is all cataracts need to be treated. This is false, because the only cataract we treat are those which are visually significant, which means we only treat cataracts which disturb vision. So basically, after a lot of changing glasses, the patient still cannot see clearly, it's time to go for surgery. Or if the cataract is minimal, however, it is sitting in the center of the pupil, blocking the vision, then obviously they need to go for surgery. Or if this cataract is giving the patient problems with daily life, they cannot drive at night, they can't see well at night, they need assistance, it's time to go for surgery. Now, sometimes I know people ask me, doctor, what is the percentage of my cataract? Is it 100% yet, or is it 70% yet? When do I need to operate? So basically, it's not the percentage of cataract which matters, it's the location of the cataract and the symptoms that it causes. That means if you have a cataract and if it's at the side and it doesn't cause you blurring of vision, you do not need to operate on it. However, if the cataract is in the center of your vision and it's blocking, it's time to go for surgery. It's pretty simple, right? Now, the next myth of cataract surgery is you can only have cataract surgery once the cataract is mature. This actually is quite common, especially even in Malaysia. A lot of my patients come with quite advanced cataract because unfortunately they have been advised to wait until the cataract is mature or white before it is safe to operate. Now, this may have been true maybe 20 years ago when we were using the manual extraction of cataract, where we needed the cataract to be a bit hard. However, nowadays, because of advances, we have the laser, we have phacoemulsification, and our machines are more advanced. We do not need to wait until the cataract is mature. In fact, it's actually safer to go for cataract surgery if the cataract is not ripe or not 100% yet, because this means the machine has an easier time taking out and removing the cataract. So what happens if the patient sits and waits until the cataract is as white as snow, or you can see it a mile away? Basically, if the cataract is too hard, this may cause sometimes the the cataract bag to be unstable, and we cannot perform the ultrasound or laser for the eye, the cataract surgery for the eye using the advanced machines. We need to revert to the old technique. The old technique for cataract surgery is basically, instead of making a cut in the eye, which is about 2 to 3 millimeters, we have to extend the incision to about 8 millimeters and manually extract out the cataract. As you can see in this picture here, it's an eye showing quite a few stitches on the cornea because the patient had manual lens extraction. So that for cataract surgery nowadays, if you have a visually significant cataract, the earlier you go for surgery, the better the outcomes. Now, the last myth of another myth of cataract surgery is basically that cataracts can grow back. Now, actually, cataracts can't grow back because we've actually taken it out of the eye. What, however, may happen and cause blurring of vision is the bag which holds the cataract becomes dirty or blurry. And this is known as a posterior capsular opacity. Now, when this capsule gets dirty, the patient does not need to go for a second surgery. They may, however, need to go for a simple procedure in our clinic where we use a laser to clean the bag. It takes less than 5 minutes to do the procedure, okay? Now, another myth I've heard of cataract surgery is that laser is better for cataract surgery. Now, if you've been seeing in the market, there are some places which advertise we have laser cataract surgery now. Basically, in cataract surgery, some centers may use a laser to make the incisions. Some center may still use a keratome or a knife to make the incision. Now, regardless of whether they use the laser or the knife, the size of the incision is the same, the location is the same, and in the hands of an experienced surgeon, there's no difference whether you do laser or non-laser for cataract surgery, as in the end, all will still use the ultrasound machine to aspirate out the cataract. Now, how do you prevent cataract? First of all, first you must go for regular eye examinations, because the sooner you detect it, the faster you can take preventive measures. Also, how you can prevent cataract, number one, stop smoking, because smoking will reduce the antioxidants in the eye and also cause damage to the lens. If you have diabetes and high blood pressure, it's good to control that as well, because poorly controlled diabetes and high blood pressure will accelerate cataract. Also, a healthy diet helps, and healthy doesn't mean just fruits and vegetables. It must be fruits and vegetables of different colors to ensure you get a variety of antioxidants and vitamins to protect the eye. And if you have a lot of sunlight exposure, just say if you work outdoors a lot, it's good to wear sunglasses to prevent UV ray damage to the lens. Now let's talk about the next condition, which is known as glaucoma. Glaucoma is a group of conditions which damages the optic nerve, and it is the leading cause of blindness for people over 60 years of age, and it's usually associated with increased intraocular pressure. Now, before you get bored by this, basically glaucoma just means for some reason or another, the optic nerve or the nerve of the eye, which helps us to see, suddenly starts to degenerate, and it's usually associated with high pressure in the eye. Now, if you look at the first picture shows a healthy, normal optic nerve. The second picture is when the glaucoma is maybe about 50%. The last picture is advanced glaucoma, where maybe 90% or more of the nerve has been destroyed due to the glaucoma process. How glaucoma happens is in the eye, our eye produces a liquid known as the aqueous. Now, once we produce liquid, aqueous has to drain out as well. If not, it will start to build up in the eye. Patients with glaucoma have a reduction of drainage of aqueous in the eye. That means this fluid, which is being produced by the eye, cannot drain out. And once this happens, this fluid will start to press on the optic nerve because it has nowhere to go, and damages the optic nerve, leading to glaucoma. It can either be open angle or closed angle. Open angle means that the obstruction to the drainage happens slowly over time. because the angles are slowly being obstructed, or the angles are a bit abnormal. In close angle, it happens almost immediately. Patient comes with immediate symptoms. The risk factors for glaucoma are if you have a positive family history. That means if you know your mother, father, or if you have relatives who have had glaucoma, it is good you go for screening earlier because the risk of glaucoma is much more in patients who have relatives with glaucoma. If you have medical conditions such as diabetes, high blood pressure, or heart disease, if patients are aged above 60 years of age, if they use steroids, if they have short-sightedness, and other factors if they had previous trauma to the eye, eye inflammation, or abnormal eye structures. Now, let's talk a bit about steroids because a lot of young patients sometimes come with glaucoma and then they always deny saying, I never did anything, suddenly I have glaucoma. Usually, these patients would have been on steroids in in one form or another. Most common, they have been putting eye drops for a long time. Steroid eye drops, unfortunately, can be gotten readily from the pharmacist anytime. So what happens is patient has a bit of red eye, they go to the pharmacist, they're given the steroid eye drop. And what happens whenever they have red eye, they keep on putting the eye drop. Then after a while of intensive steroid eye drops, they start to develop glaucoma or even cataract. Certain traditional medicines also contain steroids. That's why patients feel instantly better once they take it. Bodybuilding supplements also contain steroids, some of them. And if you see patients with chronic eczema, they would have been on long-term steroids, and this will also increase the risk of glaucoma. Other hidden forms of steroids will be in forms of nasal sprays or even asthma inhalers. So basically, it doesn't mean that, oh, just because I drop it in an eye or I just puff it in my nose, this will not lead to glaucoma because steroids in any form can cause glaucoma. So I have to be a bit careful of what we put on our skin, of what we put on our eyes, or what we puff into our nose, or what supplements we take. Now, what are the signs you have glaucoma? Usually, there are no signs, and unfortunately for patients, most of them come late. They come usually when 90% of the nerve is destroyed, and then almost legally blind. Usually, once that happens, there's no treatment, but we just try to preserve what is present. Now, what are the signs of glaucoma? Patients will have blurring of vision. This is at advanced stage, or they have tunnel vision. Tunnel vision means that centrally they can see very clearly, but peripherally they're not able to see much because the optic nerve has been damaged. Other patients with acute glaucoma, very rare, they may present with headache, eye pain, nausea, vomiting, and redness. Now, the pictures below show the damage from glaucoma and why it's so hard for patients to realize they have glaucoma because the central vision is normal until the end. So basically, patients just think that the lights are a bit dim, but they still can see. Why? Because they can see centrally. The first picture shows a normal vision of a patient. Second is when half of the nerve is gone. As you can see, the patient can still see in the center, so they assume they can see. Then the last one is severe glaucoma, where they just see the center, but they assume, oh, the rest is just a bit dull. Now, treatment of glaucoma. At the moment, there is no cure for glaucoma, but however, like high blood pressure, we can prevent the progression of glaucoma if it's detected early. Now, treatment of glaucoma would be in terms of we can use eye drops. That's the first line, as you can see here, or we could use laser or surgery. All these treatments aim to control the intraocular pressure so it will not further damage the nerve, and hopefully the patient will have good vision beyond their lifetime. That means if the patient lives long enough, they may go blind from glaucoma, but when we give them eye drops, laser, and surgery, we've basically prolonged their vision until after their lifespan. So basically, hopefully, they won't go blind with glaucoma. How do we prevent glaucoma? There is no way to really screen glaucoma at home by yourself. So the best way is still to go for regular comprehensive eye examinations where you need to go not to a spectacle shop but to an eye doctor where they need to do a complete eye examination to check for glaucoma. They need to check your pressure, they need to do special scans to compare your optic nerve with other people to make sure it's fine. Then exercise also has been shown to prevent glaucoma. Not all exercises, more like the ones where you sweat a bit, the cardio exercises. Even a simple morning walk or evening jog, 1 week at least 2 to 3 times for about 15 minutes is preventive against glaucoma. If you drink a lot of coffee and tea, it's time to stop or reduce or stop your caffeine intake, because caffeine will markedly increase the intraocular pressure. If there is diabetes and hypertension, those need to be controlled, and most importantly, avoid corticosteroids. The next complaint patients may come about are floaters. Now, what are floaters? Floaters are basically spots or lines, or some patients may complain of cobwebs or wiggly things moving around the eye, and these usually change with eye positions. Floaters, most of the time, is due to age-related, could be due to bleeding, retinal holes, or eye inflammation. What happens with age-related floaters is like this. In our eyeball, we usually have a jelly in our eye known as the vitreous. So usually above 50 years of age, this vitreous starts to liquefy, and bits and pieces of the vitreous start to float around the eyeball. And if they float past the macula, or the place where we see clearly, the patient will notice they have floaters. Most of the time, it doesn't cause any problems. However, sometimes this vitreous may pull on the retina and cause serious things such as retinal detachment. So if patients have floaters, it's very good to go for an eye checkup to make sure it's nothing serious. Now, what are the signs of dangerous floaters, and how do we know that it's time to go to the eye doctor fast? Or just say we've had an eye examination, we've been told the floater is normal. When do we know when suddenly the vitreous is starting to pull on the retina, or the floater is dangerous? Is when we see persistent flashing of light. That means even if you close the eyes, the lightning is still present. It never stops. This is a sign that the nerve is being pulled. Go to the eye doctor fast. Or instead of the normal 1 or 2 floaters, you suddenly see 100 floaters, 200 floaters, a lot of floaters. Or if the floaters change in color, become brown color, red color, this may be due to bleeding in the eye. Or obviously, if there's sudden loss of vision or eye pain, please go and see the eye doctor faster. So what do you do if you have floaters? Always make sure you see the eye doctor for a full dilated eye examination. And the doctor will advise how regularly you will need eye checkup after that. The last condition some patients may come with, actually it's quite common in most patients nowadays, are tired eyes. They present usually with red eyes, they feel something in the eyes, or the eyes are itchy, they have some white watery discharge, or after long hours of work, patients are unable to focus. So if they have these conditions, the patient actually may have dry eyes. Now, what are the causes of dry eyes? Now we are having MCO lockdowns, so a lot of people are on their phones, on their tablets, seeing TV a lot more often. So this will lead to eye strain and digital eye syndrome. So if we are looking at a lot of digital devices, we will forget to blink, and when we forget to blink, we produce less tears and cause the eyes to be dry. Also, if the patient wears contact lens, because contact lens will dry the eye, if they're on special medications which dry the eye, if they have previous eye surgery or aging. Now, treatment for dry eyes basically is healthy eye habits, warm compress, tear replacement, supplements, and other treatments. So what do you mean by healthy eye habits? Well, if you are seeing a lot of screen time, it's good to, if possible, reduce screen time. But however, sometimes people work on the computer from home, right? So what else can you do? Well, you can follow something called the 20-20-20 rule, which means every 20 minutes, you rest the eyes for 20 seconds looking at something far. This will reduce the strain on the eye. Also, best is to, if you can, close your eyes every 20 minutes just to blink a bit, all right? The next you can do is something called warm compress. You can take a towel or handkerchief, Put in as hot or warm water as you can stand. Squeeze the towel dry. Close both eyes and place the moist warm cloth on both eyes for maybe about 5 minutes. You can do this 2 to 3 times a day. This will naturally stimulate your tear glands to produce more tears and reduce the symptoms of dry eyes. If the dry eyes are really bad, you can also go for tear replacement in terms of eye drops, ointments, and eye ointments. These can be with preservative or preservative-free. Well, tear replacements are usually when you know the eye is so dry and symptomatic. Eye drops are usually preferred because they are less sticky. I usually tell my patients it's best to go for preservative-free medication because you can put it long-term. If you choose an tear replacement with preservative, ideally you should not use it more than 3 months because after that you'll need to stop it to give a chance for the preservatives to wash out of the eye. All right. If the eyes are very dry, you can also try supplements such as omega oil supplements. These will soothe eyelid inflammation and promote tear production. You can also get natural supplements from fish, nuts, and leafy vegetables. If the dry eye is really bad, your eye doctor can put something called punctal plugs. These are actually specialized silicone plugs to reduce the tear drainage from your eye, or we can even give you IPL or intense pulse laser. So the take-home message from my talk today is basically for healthy eyes, you just need to go for regular eye examinations. And if you have eye problems, get it treated early and you will have a good eye outcome. And if you have any eye problems, it's best to see your eye doctor earlier rather than later. With that, I thank you. If you have any questions or if you want to watch anything else, you can always go to my Facebook or YouTube channel. With that, I pass it back to Kasturi. Thanks.
All right, thank you so much, Dr. Fiona, for that wonderful sharing session. So without further ado, let's move on with the Q&A session, and dropping a gentle reminder to our audience, you can still send in your questions and we will get them addressed by Dr. Fiona now. Okay, so let's take a look at the question. Okay, there is one about my grandfather had cataract surgery years ago and he had to wear thick glasses afterward. Is this still necessary?
If he had his surgery about 20 to 30 years ago, the technology would not have been advanced. That means they took out the cataract, but they did not put a lens into the eye. That means he's basically left aphakic, no lens. That's why he has to wear very thick glasses. Nowadays, we put a lens into the eye to replace the cataract. So usually patients don't need to wear glasses most of the time.
Okay, and the next question would be, how much does a cataract surgery cost, Dr. Fiona?
Okay, it will depend on the medicals. It basically depends on the medical center. If you go to government, you will be basically asked to pay for the price of the lens, which could be about 800 to 900. And then you have the normal charges, maybe about less than 1,000. If you go to private centers, it can range from anything from 2,000 plus all the way to 10,000, depending on what type of lens you put into the eye. Because the cost of the surgery sometimes depends on the lens. If you choose the standard lenses, that means they're cheaper. If you choose the special lenses, which correct astigmatism, let you see far, let you see near, obviously, they're much more costly.
All right, and there are quite a number of questions on myopia. Can myopia be improved using eye exercises?
For myopia, if you are a child, the exercises which do improve your vision is number one, switching off the iPhone or iPad, no more digital devices. Number two, letting them go out to play in the sun, because this will naturally reduce the risk of increase of myopia by 30%. However, eye exercises alone do not help to reduce myopia, other than the fact that if you just close your eyes to just rest it from the screen.
Okay, thanks, Dr. Fiona. And another question from the audience. If you use eye drops for dry eyes, wouldn't that increase steroid use?
The eye drops which you use for dry eyes should be tear replacement preservative-free eye drops, not steroid eye drops. Steroid eye drops are only used in specialized conditions and must be monitored by an eye doctor. The only time we use steroid eye drops are usually after cataract surgery for a very short period, or if the patient has certain types of eye inflammation, but we don't use steroid eye drops for dry eyes. Usually, if you use preservative-free medications, this will help the symptoms and won't worsen it up. The only time which it may worsen is if you use eye drops with preservatives. Because eye drops with preservatives, they're supposed to wet the eye, but unfortunately, after you use about like 2 to 3 months, the preservative starts to accumulate in the eye and it starts to worsen the dry eye. Okay?
Okay, and yes, so in the condition of a child having myopia, will their vision get worse after year?
It's not to say if you don't treat the myopia, obviously it's going to get worse because they can't see. And it's a bit dangerous for children because children's eyes are still developing. So basically what happens is when they see a blur image, the brain thinks, oh no, I can't see properly. And it forces the eyeball to grow unnaturally long to try to get a sharper focus. It's like a weird mechanism. So because of that, if the myopia is not treated, it just becomes worse and worse. And obviously, it may come to a point where the child may go blind because the brain has stopped using the eye. It becomes densely and myopic. So myopia, if not treated, can worsen.
Oh, and continuing with that, will it lead to blindness as well, myopia, if it's not
Yes,
treated?
if myopia is high enough, just say if you're above 400, your risk of getting retinal detachment, that means the nerve detaching from the eyeball, or the risk of glaucoma or cataract increases substantially. That's why usually for children, if we see the myopia approaching 300, we try to start them on special eye drops or lenses to try to make sure they don't hit the 400 mark.
Okay, and another question is from Ms. Lavanya. Does wearing contact lenses prevent vision power from increasing?
Wearing contact lenses doesn't prevent the power from increasing, but more importantly is that you are wearing the prescription which is correct for your eye. So it doesn't matter if you're wearing spectacles or contact lenses. Most importantly, that power must be able to allow your eye to see clearly, then your power will not increase. And obviously the other things matter, like don't see so much handphone, go outdoors more often. That's more important.
Okay, we have another question from our academic, Dr. Fung Waiting. After cataract surgery, how long does the patient need to wear dark glasses?
Actually, it's not so much of dark glasses. Usually for my patients, at home, they don't wear dark glasses. It's just when they go out, because sometimes after surgery for about first few days, the eye is pretty sensitive. So we tell them dark glasses. But if the patients don't like dark glasses, they can also wear clear glasses. It's just to protect so that if they go shopping or if they're going, to a restaurant, dust particles don't fly into the eye. It's more for protection of the eye rather than really need to wear the sunglasses.
Okay, thanks, Dr. Fiona. Another question is, can a person be nearsighted in one eye and farsighted in the other?
Is that like after surgery or like naturally
No, I
born?
think, yeah, I mean, not related to the surgery, but if they have nearsighted in one eye, just farsighted in the other, can they develop such?
Yes, some children actually are born with unequal powers in both eyes. This condition is known as anisometropia. So that's why it's actually important for children to be screened earlier, because if we detect this early and we're able to give the correct prescription, both eyes will not become lazy. Because what happens is like this: if one eye is very high powered and one eye is low powered, the brain will automatically choose to use the eye with the low power, and it sort of ignores the eye with the high power, so that high power eye becomes lazy. And if it's left low, the brain just does not use it anymore, and it's like permanent. So it is possible for a patient to have different powers in both eyes.
All right. And another one, is it true if diabetes patient will develop retinopathy faster after cataract surgery?
After cataract surgery, actually it depends on the diabetic control, because cataract surgery will induce a bit of inflammation. So that's why for diabetic patients, sometimes we may see them a bit closer. But yes, sometimes diabetic changes may worsen after cataract surgery. But if the diabetes was controlled in the first place, this is not a cause for concern.
All right. And another question from Dr. Fung. What eye drops do you recommend to slow down glaucoma?
Glaucoma, we have a range of eye drops. Usually the first line will be the beta blockers if the patient has no heart problem. We also have prostaglandin analogs. There's basically a whole range. It depends on the patient's symptoms and their medical conditions. If they don't have heart problems, usually they're started on beta blockers. If they have heart problem, usually they're started on prostaglandin analogs. If they find it very difficult to put eye drops, we will try to look for eye drop which is once a day. So it basically depends on the patient's lifestyle and depends on their reaction to eye drops. Because some patients, when they put certain eye drops, they get like very bad red eyes. So we keep on needing to switch to allow the patient to have good quality of life with the eye drops.
All right, Dr. Fiona. Another question is, can I have cataract surgery if I have glaucoma?
Yes, actually, sometimes for cataract surgery, it is one of the treatments for glaucoma because some of the patients actually have glaucoma due to a swollen cataract or a swollen lens. And sometimes I have patients who have been on 3 drops, 4 drops, because the cataract is busy obstructing the drainage system of the eye. The minute you take out the cataract, the pressure drops to way below normal. So actually, we can reduce the eye drops or even theoretically reduce the need for eye drops. So, yep. You can have cataract surgery if you have glaucoma, and sometimes it is recommended you go just to reduce the intraocular pressure.
Okay, we have another question from our academic, Dr. Ho. When will be the best time to do a cataract surgery? Do you recommend doing it as early as possible?
Basically, it will depend on what they find in your eye examination. If you don't have a cataract, obviously no point going for surgery. There are some patients, I've been following it for years, never ever have visually significant cataract. So they are the super lucky ones. But just say you've been diagnosed with a visually significant cataract, driving at night is bad. You know, you complain the lights are dim and everyone tells you it's not the lights are dim, it's your eyes are dim. Then the minute you get a visually significant cataract, it's better to go for it earlier than faster. So it just depends on when you were diagnosed with that cataract.
Okay. And another question is, what is a secondary cataract, Dr. Fiona?
Okay, I think I actually addressed it in my talk just now. Basically,
Okay.
a second actually means that they're asking if the cataract grows back. So basically, sometimes after cataract surgery, maybe about 5 to 10 years later, depends on what lens was implanted into the eye, the patient may start complaining of blurring of vision again or like something obstructing the vision. So basically, it's not that the cataract has grown back because we've actually sucked up the cataract. But what has happened is that the bag holding that artificial lens has started to become a bit dusty or dirty. So once this happens, the patient just needs to go for a simple laser procedure in clinic. It's not an operation. You just sit down at the machine, we just shine the light, and then we'll just clean it up for you. Then after that, you will not have a 3rd cataract or a 4th cataract. That's the end of the story already.
Okay, and another question is, are there any ways to slow down myopia? And what is your comment on special glasses with multiple pinholes?
Okay, the multiple pinholes just makes you see clearer because you're having a pinhole effect. Basically, you're reducing all the light going into your eye into one pencil of light. So because one pencil of light goes in, you see a bit clearer, but this does not reduce your risk of myopia. Reducing the risk of myopia, number 1, stop the gadgets for the child. No iPad, no iPhone, no TV. Don't give them digital gadgets, especially when they're eating. This is common thing parents do. Number 2, they need to go out and have natural sunlight, not shopping mall sunlight, natural sunlight for at least about 15 to 20 minutes, if possible, 3 times a week. Then what else may reduce myopia? Correct spectacle power, because unfortunately some children come where they've seen someone else and they're given the reduced power because they're scared to prescribe the full power. And what this happens is if the power is not adequate, the brain interprets this as SOS, I cannot see. Then the myopia increases. So it's important for them to wear glasses with the correct spectacle prescription. Then if we find the myopia progressing, obviously there are special drops such as low-dose atropine, 0.01%, which Singapore has studied extensively, at least for 10 to 15 years. There are also things like auto-K lenses for bigger teenagers. If they don't want to put eye drops, they can wear the special contact lens when they sleep, and when they wake up, they don't need to wear glasses. We also have those. So we do have quite a number of treatments for myopia, but the simplest one is just switch off the iPhone now, or switch off the digital devices.
Okay, and another question will be, can long-term allergy reactions affect eyesight, and what are the dangers in eye allergy?
Okay, long-term allergies, you mean for skin allergies or eye allergies? Oh, I'm not sure. Okay, anyway, let's just talk about allergies in general. I have seen a lot of itchy, scratchy patients. Why do they come? Because they cannot see. Why? Because they've been on long-term steroids on their skin, which they've been assured it's safe. What happens is the steroid absorbs into the bloodstream, goes to the eye, causes cataract and glaucoma, and makes them blind. Unfortunately, had quite a few young patients become nearly blind, and we can't do much. Why? Because nerve is damaged from glaucoma. So if they're having very bad eczema and if they're on long-term steroids, they have to be referred to an ophthalmologist to rule out glaucoma. Maybe they have to change to, something else instead of that. And eye allergy per se, usually won't cause you to go blind unless it's not treated properly. Because what happens when they rub so hard, they can cause scratches and cause like ulcers on the front of the cornea and shield ulcers lah. But usually, well, should not cause blindness lah.
Okay, and another one on cataract surgery. Can this surgery be performed on both eyes at the same time?
Now, this is a very tricky question because most eye doctors will not do on both eyes because this increases the risk of, when we do cataract surgery, there's always a risk of infection, there's a risk of going blind. So most surgeons will always do one eye, then we let the patient go home, see how they heal with that cataract before we proceed with the second eye. Because if we do both at once and if go home, the patient doesn't take care, the patient will go blind in both eyes and that's it for them. There are very special circumstances where I will do both eyes at once, and this is usually for children, because just say if very high anesthetic risk and they're bilateral congenital cataract, straight away I'll do both eyes at once. But then they have to have very special regimes for that to monitor for infection.
Okay, and next one is, can I wear contact lenses if I have astigmatism?
Yes, they are called toric contact lenses actually. They're specially for astigmatism. It also depends on how high astigmatism is. So I don't think it's a problem wearing contact lens for astigmatism. But only thing, when you wear contact lenses, you have to be careful because it's the hygiene thing. Contact lenses causes a lot of dry eye, number one, and it causes a lot of eye infection. Recently, I think in the last 2 weeks, I've been having like 4 or 5 patients all come with white infection from contact lens. So just have to make sure you take care of that when you use the contact lens.
Okay, let me see for more question. How about cataract surgery after LASIK surgery, Dr. Fiona?
Oh, LASIK surgery. Well, it's not a problem to do cataract surgery after LASIK surgery. Only thing sometimes that may be a reduced chance of the lens being accurate lah. Because what happens when you do LASIK, you thin the cornea. So sometimes when you do the measurements for what lens to implant into the eye, it may not be as accurate compared to a person who has never done LASIK. But even that in mind, it's still safe to go for surgery because our calculations have become quite advanced, so it shouldn't be an issue lah.
All right, and next is on glaucoma. Is glaucoma a hereditary condition?
Yes, if you do have relatives with glaucoma, please get screened immediately. Definitely, there is a very, very high risk of glaucoma if your relatives had glaucoma.
Okay, and okay, give me a second. Maybe we will take another 2 more questions and then end the session. Is nearsightedness reversible, Dr. Fiona?
In a child or adult?
In a child, yeah.
Okay, because in a child, children are born naturally nearsighted because their eyeballs are shorter. As they grow up, the nearsightedness actually disappears. So it's not say reversible, they just grow out of it.
Okay.
However, for adults, there is another phenomenon. It's when their cataract gets thicker. Sometimes they realize they don't need to wear the glasses anymore, or they get the second sight again. So it's not because their nearsightedness has gone, it's just because the cataract has started causing some myopia. I mean, that is one rare condition now where that may happen now. Okay.
Okay, and another question. Do we need to refer ophthalmologists for eye screening for allergic I don't know if I'm pronouncing it right, allergic rhinitis or bronchial asthma patient who is on nasal steroid or inhaler? And how often do we need to refer them for screening?
Okay, it depends on the duration. If you're just treating like for 6 months, all is fine. But if the patient's on at least more than a year, they should at least go for one eye screening to get the baseline. If there's no problems, the ophthalm may see them maybe 1 year once, just to make sure, and especially if they're still on the steroids long term. Because anything obviously more than a year, you're going to increase the risk of glaucoma, increase the risk of cataract.
Okay, and yeah, okay, let's take one last question, Dr. Fiona. Can vision that is lost due to glaucoma be restored?
Nope, but you can preserve what is left. Usually when patients come with glaucoma, they actually have little bit more central vision left, and this is the vision we're trying to preserve. That's why for glaucoma, the earlier you see the eye doctor, the safer it is.
Okay, so with that, we'll wrap up our Q&A session. Thank you so much, Dr. Fiona, for your time today. And yeah, so this is the end of today's event, which is the final session of the Go Beyond Keynote Speaker Series for this year. And we featured our alumni, Dr. Fiona from the class of 2002. So audience, if you have any other questions, please feel free to email us at enquiry@rcsiucd.edu.my. And once you leave the session, you'll receive a short survey on today's keynote session, and we would appreciate it if you would complete that and provide your feedback. And you will also receive a follow-up email within 24 hours with a link to view a recording of today's event. And finally, on behalf of RCSI and UCD Malaysia campus and our speaker, Dr. Fiona, we would like to thank you for joining us today. And yeah, till then, take care and stay safe, everyone. Thanks, Dr. Fiona.
You.
Bye-bye.